Imagine giving birth to triplets and not even knowing you were pregnant. Ladies
Greetings to
say,
all. What are the primary elements that could have led to this couple's position, as you listen to it? When a pregnant person is unaware that they are pregnant, it is referred to as a cryptic pregnancy, or stealth pregnancy. Sometimes a person won't even know they're pregnant until labor starts. This is what happened to the woman who gave birth to triplets. How is it even feasible to have triplets when she showed no indicators of pregnancy? She argued that it is actually astounding that these fetuses chose to rest in her back rather than her stomach, since the doctor had mentioned that the babies were in her back. When the doctor performed an ultrasound, they were surprised to discover that there was a third baby in addition to the 2 heartbeats they had initially detected. The triplets' mother visited the doctor because she was experiencing back discomfort and believed it to be a gallstone issue because she had before. But to her shock, she was giving birth. Most women become aware of their pregnancy between 4 and 12 weeks of their pregnancy. This can be the case if they are exhibiting pregnancy-related symptoms or if their period was missing. A positive pregnancy test result can confirm being pregnant. Nothing makes a person think they are pregnant when they have a mysterious pregnancy. This might be the case if they don't experience pregnancy symptoms, think they are caused by a virus, or if their pregnancy test result was inaccurate. Who is susceptible to cryptic pregnancies? A mysterious pregnancy can happen to anybody. You might be more vulnerable if you 1. You recently gave birth. It may take many months for your period to start coming back, and if you're breastfeeding, chest feeding, you might not ovulate. This may lead some people to believe they are entirely protected from getting pregnant. When you'll first ovulate while breastfeeding and become fertile once more is impossible to predict. 2. Suffer from a disorder like polycystic ovarian syndrome, because those who have PCOS get irregular periods. They are accustomed to skipping periods, so if they do so, they might not detect pregnancy. 3. Use birth control. Women who use contraception may believe they are immune to pregnancy. Even when used properly, there is a slight possibility of failure. 4. Are in perimenopause. Women in their 40s may believe they are too old to become pregnant or confuse the signs of pregnancy with those of menopause. 5. Never been pregnant. If you haven't given birth previously, you're less likely to be familiar with how it feels. Therefore, it may take longer for a pregnancy to be discovered. Will a pregnancy test reveal a mysterious pregnancy? A cryptic pregnancy should nevertheless result in a positive pregnancy test. The only way to obtain an accurate result from a home pregnancy test, though, is to use it properly. Incorrect usage of the test could result in a false negative, which would suggest that you are actually pregnant, but the test indicates otherwise. Wait a few days following your missing period before taking an at-home test, as directed on the package. It's essential to always have a healthcare provider confirm pregnancy with a blood test if your symptoms and the results of your home pregnancy test don't line up. Have you ever experienced a mysterious pregnancy? No. Because you don't experience a true menstrual cycle, cryptic pregnancies are similar to regular pregnancies in this regard. You might mistake implantation bleeding or unusual pregnancy bleeding for your period, though. What symptoms indicate a mysterious pregnancy? The symptoms of a normal pregnancy are present in people with cryptic pregnancies. The main distinction is that a pregnant person is unaware that pregnancy is the root cause of their symptoms. For instance, people can believe they're tired because they need to get more sleep or that they're sick as a result of eating a particular cuisine. Additional indications of a covert pregnancy include 1. Weight gain or swollen belly. Some women may not realize they've gained weight while pregnant, or they may blame consuming a particular food for an excessively bloated tummy. 2. Fetal movement. Until about halfway through pregnancy, most people do not feel the fetus move. The placenta is in the front of your tummy if it is anterior. Kicks may be harder to feel as a result. This can be the reason you are unaware that you are pregnant in the instance of a cryptic pregnancy. 3. Ignorance of pregnancy symptoms. If you're very young or have developmental impairments, you might not be aware of typical pregnancy symptoms like a missed menstruation, sore breasts, or nausea. 4. Missed period. While the majority of women are aware that they are pregnant because they don't get their period, this isn't always the case. You might not be aware that you missed your period because of pregnancy if your cycles are always erratic. 5. Spotting or light bleeding. In the early stages of pregnancy, some women experience mild spotting that they mistake for a period. 6. False negative pregnancy test result. This occurs when a test indicates that a woman is not pregnant when in fact she is. An at-home pregnancy test can give you an incorrect result if you don't use it properly. It's best to speak with a healthcare professional to confirm a pregnancy in order to be certain. What is the duration of a cryptic pregnancy? Around 20 weeks into a pregnancy, the majority of women become aware of their pregnancy. However, a person can go the entire 40 weeks of pregnancy without knowing they are pregnant. There have been instances where someone with pelvic pain visits the emergency hospital just to find out they're giving birth. According to some research, premature delivery is more likely to occur in cryptic pregnancies because of inadequate prenatal care, poor nutrition, or lifestyle choices. Depending on when you find out you're pregnant, cryptic pregnancy treatment may be necessary. A pregnancy care provider will attempt to make up for any missed prenatal care if your due date is still months away. This might comprise tests on blood and urine, ultrasound, determining the fundal height, a medical checkup, counseling on diet and lifestyle. I pray that everyone who watched the video took something away with them. I wish the triplet parents the best of life and am happy that all is well. Do you think a mysterious pregnancy qualifies as a miracle? Please tell me.